What caused the disease?
It's a sexually transmitted disease. It's also transmitted by the blood. It's a contagious disease, so it's caused by infectious contact with the blood of an infected person.
How serious is it and how does it affect the patient's lifestyle?
It is very serious and it's a cause of death, and it also affects a lot the patient's lifestyle. His or her immune system gets really affected, so everything changes. And the person can get any sort of disease at any time, and all the lifestyle has to change.
What is the short-term and long-term prognosis for this disease?
The short-term prognosis is that the person has to change everything because he or she can get a lot of diseases, and long-term, well, eventually the immune system gets so low, or his defenses get so low that it eventually causes like pneumonia or another disease and causes death.
What was the chief complaint that the patient had for consulting?
The main complaint of a person with AIDS usually starts with a lot of infectious diseases or aches in the body. Sometimes it's a liver disease, that's very often. Or usually also the first complaint is sickness, and the person is very tired and cannot go on with his usual activities because of the tiredness.
What other symptoms does the patient present?
Other symptoms include very often skin problems, depression, anxiety, and all the diseases related with a low immune system.
How can the patient be tested for the disease and what does this test reveal?
When a person suspects HIV, the final diagnosis is by the blood. So he or she has to get a blood test, and then she has to do the same test 6 months later, and then 6 months again later, so that it is a confirmation of that person has the disease. So it's a blood test.
What treatment is the patient receiving and how effective it
Well,
is?
since the disease is caused by a virus, the person has to take an antiviral medicine during his whole life, and medicines to strengthen the immune system during his whole life also. And if a person gets any other disease, infectious disease, he has to get the proper treatment for that specific disease. Okay, so the patients that get this treatment, if the treatment is in an appropriate stage of the disease, it is very effective. They can last for their whole lives, like years, 20 years or 30 years. And if they are constant with their medication, it's very effective. If the disease is detected like not in an early stage, then the treatment might not be as effective and the person might die earlier.
What are new technologies that can be used to prevent HIV?
Okay, so new technologies include giving information to the people in the community so that they can be aware of this disease. That would be the first prevention thing to do. Also, blood tests to the people that are getting married or that want to have sexual relationships. In the case of the women that get pregnant and have AIDS, a way of preventing that the child gets infected because of the mother's disease is every pregnant woman has to get a blood test so that we can ensure that she has or doesn't have AIDS. And also a prevention test would be always the blood test. For the blood transfusions, now there are new technologies that can detect AIDS so that no one gets infected by a blood transfusion. And well, the treatment includes early stage treatment, as I said before, so that the virus can be reduced to the minimum level. And well, there are a lot of new treatments for the immune system so that you can strengthen that system and that the person can live for longer.